Okay, let's go through the exercises. As I mentioned earlier, the hip joint is a more complex joint than the knee joint, so the hip group has more exercises than the knee group. There's about 18 exercises for the hip group. You're going to pick 6 of those exercises to do in the morning, a different 6 to do in the middle of the day, and the last 6 to do in the evening. Whereas the knee group will do all of their exercises 3 times a day. So let's start with the hip exercises in the seated position. So first you're going to bring your feet right close together. You're going to put your hands between your knees, and you're going to spread your legs apart as far as you can. And then you're just going to hold it there for a few seconds. And then you're going to slowly bend forward with your hands between your knees. And then you're going to hold that for a little bit. And then you're going to grab your pant leg on your operated leg, or you can grab your sock and you're going to try to bring it up towards your unoperated leg. This will be very difficult to do while you're in the hospital, but by the time you finish your physical therapy, you'll be able to do this. Great. Bring that back down. All right. We also work on bending your hip. You're going to scoot your rear end all the way back in the chair, and you're going to try to bring your knee up towards your chest. This is going to be hard to do without some assistance, so you can also use your hand to help. Excellent. Back down. Or you can also use a towel wrapped under your thigh. And you want to make sure that you keep your back straight. Bring it up and hold it. When you're bending your hip, once you get to a 90-degree angle, it's important to bring the leg up and out. Great. Okay, now let's do the seated exercises for the knee group. How you sit in a chair is very important. We don't want you sitting in a chair with your leg in this intermediate position. We either want your knee all the way bent, working on bending, or all the way straight, resting on a table or a chair, working on straightening. It's very difficult to stretch your own knee, so the best way to do it is in a seated position in a chair. You want to choose a chair that's a height so that your thigh is level with the ground. If it's not level with the ground, you can use a ream of paper or a book to put underneath the foot to have your thigh level with the ground. You want to make sure you're seated all the way back in the chair. And then you're going to try to bend your heel underneath the chair as much as you can. You can use your other leg to help, or if anyone else is around, they can help you. When you feel like you can't possibly move your knee back anymore, then you're going to bring your fanny forward. And you can see how you use your body weight to get an extra bend out of your knee. And then you're going to hold it there for as long as you can. The other exercise in the seated position is called leg kicks. So you're just going to slowly kick your leg out, and you're going to hold it for a couple of seconds and then lower it back down. And the hip group is also going to do this exercise. So just kick it out, hold it for a few seconds, and bring it back down. Great. There are 3 exercises for the hip group to do in standing. When you're home, you can do these using your crutches. You can also hold on to an arm or chair or even the kitchen counter. The first one is bringing your knee up towards your chest. When you do this, you want to make sure that your back is straight and just your hip is moving. The next one, take your crutch, is bringing your hip out to the side. Once again, shouldn't be tilting to one side. The rest of your body is nice and straight and just your leg is moving. And the last one is kicking your leg backwards. We'll have you turn this. Once again, nice and straight and just kicking your hip backwards. Great. Okay, now let's look at the exercises while lying in bed. We're going to do the hip group first. So when you're in the hospital bed, most of the day you'll be lying with your head up, having your meals, talking to family and friends. So that means that your hip is bent all day, and we want to make sure that it gets a chance to stretch out. So at least 3 times a day for a half an hour, you're going to lie completely flat in bed like this. You'll need to use the bed controls to make the head of the bed all the way flat. While you're in this position, you can do an exercise called the Thomas stretch. So you're going to bring your good leg up towards your chest, and you're going to hold it up there at the same time pushing your operated hip down so it gets a chance to stretch out in the front. Great. Back down. All right. We're going to work on bending your hip just like we did in the chair. So you're going to bring your knee up towards your chest. You can use your hands to help just like you did in the chair. And once again, if your arms aren't long enough, you can use a towel to help. Remember to bring your leg up and out once you get past that 90-degree angle, and then back down. Okay. We'll also work on bringing your leg out to the side. So just slide your leg out to the side and back in. You want to make sure that you don't lift your leg up and bring it out. That puts a lot of pressure on your hip. You want to make sure that your leg stays in the bed. This will be hard to do the first couple of days after surgery, but you should be able to do it before you're discharged home. We talked about being careful about rotating your hip in when you're in a seated position, but when you're lying flat in bed, it's okay to do that exercise. So while you're flat, you have to make sure you're flat. You're going to rotate your leg inward and then back out. And try to keep your fanny down and just roll your leg inward and then back to the center. Great. All right. Both groups do ankle pumps, just pumping your ankle up and down. That helps get the fluid out of your leg. All right, great. There's also an exercise called knee straighten. We'll put this under your knee just temporarily. And then you'll go ahead and just kick your knee straight, just like we did in the chair. Hold it for a couple of seconds and back down. The knee group will also do this exercise. Kick it straight and then back down. Great. All right. Just want to talk a little bit about positions of sleep for the hip group. So certainly you can lie flat on your back like this if you're comfortable. You can lie on your operated hip. I'll go ahead and roll back over. It's a very safe position for your hip to lie in. You have a fresh incision, so this probably isn't going to be comfortable for the first week or two, but it's an option for you to sleep that way. Most patients would prefer to sleep on their unoperated hip. So to roll on your unoperated hip, you're going to put a pillow between your legs, and I'll go ahead and roll on your unoperated hip. The pillow helps to keep your hip in a safe position. Without the pillow, your hip could go into a compromised position. It's also helpful to have a pillow here as well. That way, if you're an active sleeper, your hip is supported no matter which position it moves into. Before you leave the hospital, we'll also teach you how to roll onto your stomach. Take this back out. Go ahead and roll over. Just lying on your stomach is a great stretching exercise for the front of your hip, but there are also a couple exercises we'll do. First, just bringing your leg up towards the ceiling. Great, one more time. Excellent. And then we'll do one on all four. So go ahead and get up on your hands and your knees. And then just kick your leg backwards. Perfect. And then go ahead and let back down. Great. Let's go over the knee exercises while you're lying in bed. First, let's talk about positioning. Keeping your knees straight is equally as important as keeping it bent. So 3 times a day for half an hour, you're going to place a towel roll underneath your heel and just rest your leg in this position. Gravity will come down and stretch out the back of your knee. When you're home, if you're mobile enough to sit on the floor, that would be great. Otherwise, the bed is preferred to a couch because it's a little bit more stiffer. Some patients sleep with a pillow underneath their knee. This should be avoided after surgery. It can result in a flexion contracture. We will do an exercise in this position called knee kicks. Go ahead and straighten. Hold for a second and then back down. But this pillow should only be here for this exercise. You don't want to have it there for a long period of time. We'll also work on bending your knee while you're laying in bed. Call this a heel slide. You're just going to slide your leg along the bed and then back down. This is a painful exercise, so we just usually just go up and then stop there and let you take a breather and let the pain subside. And then we try to go up a little bit further and then take a breather and let the pain subside. We have a tool called a goniometer, kind of looks like a protractor, and we'll use that to measure your joint angle every day. And as long as you're making gains, then we don't have to continue with this exercise. The last exercise is what we call leg lifts. You're going to bend your good leg. This helps protect your back. You're going to tighten your thigh muscle and make your knee as straight as you can. And then you're going to try to lift your leg as high as your other leg. Hold it for a second and then back down. This will be difficult to do the first couple days. Most likely you'll do it first with a bent leg. It'll look kind of like that. But before you leave the hospital, you should be able to lift it with your leg almost straight. Great. For patients having their knee replaced, a stationary bike can be beneficial to work more on your knee bending. If you don't have a bike but can borrow one from a friend or a family member, that would be beneficial. Don't try to get on the bike by yourself. It can be tricky. Wait to do this with your home physical therapist. It may take a while before you can do a full revolution on the bike, but once you're able to pedal normally, you should gradually lower the seat, which will result in your knee getting more and more bend. The hip group can also use a stationary bike for general flexibility and strengthening. Before we wrap up, I want to talk a little bit about your home environment. When you return home, we want you to resume your normal activities of daily living as soon as possible. There's no need to move beds downstairs. We encourage you to use the stairs to go up and down to your bedroom as you would normally. We would rather have you sleep in your own bed. A good night's sleep and naps are important for healing. The only thing that we do recommend is if you have throw rugs that you remove them. They can be particularly hazardous with crutches. Which chairs you choose to sit in at home can also be important. The best type of chair to sit in is a firm chair that has armrests, like a dining room chair or a kitchen chair. Couches and recliner chairs are often too low or too soft and can be difficult to get out of, particularly for patients having their hip replaced. Recliner chairs typically put you in a flexed position, which we are trying to avoid for long periods of time. If you are uncertain whether a chair is appropriate or not, you can discuss this with your home physical therapist. Proper footwear is also important. You should not wear any slip-on shoes or sandals. Tie shoes are preferable, as is a shoe with a rubber sole. You will have swelling for some time after surgery. Once you are spending more time upright, it's not unusual for the swelling to travel down to your foot and ankle. A tie shoe allows some extra room for this swelling. The more you are up and moving around, the more the swelling will move out of your body. The typical course of physical therapy will be varied. It can range anywhere from 4 weeks to 12 weeks. You want to make sure to let your outpatient physical therapist know what activities you're hoping to return to. Please share with them your goals. For example, you may have a goal of returning to gardening or playing golf, or to return to a job that requires climbing ladders. You will be able to do whatever activities you desire at the completion of your rehab. That being said, some activities are better than others. Typically, a prosthesis lasts at least 15 years. Knee prosthetics tend to last longer than hip prosthetics because the hip joint is a more complex joint. You can run a marathon, you can ski, you can play tennis, but if you choose activities such as running, which is a lot more wear and tear on the joint, you probably won't get 15 years out of your prosthesis. Try to choose activities that have less impact on your joint, such as swimming, walking, and biking. Thank you for taking the time to watch this video. Remember, you can review any of this information in your total joint binder. If you have any unanswered questions about physical therapy, you can call the department at 617-632-0533. Thanks again.